so you thought you were done with me, but here I am again. I'd like to talk with you today about something a little bit different than yesterday. There's something very interesting happening in the United States that I think that you'll also find interesting, and that is that despite the fact that drug use has not gone up very much at all, and alcohol use is, in general, coming down, we've seen a very large increase in deaths due to poisoning. And so I want to talk with you about the fact that sometimes trends in drug use don't tell the whole story. And while overall use may be coming down, the public health effects of a drug may be increasing. And we're seeing that with a variety of drug categories. So I'd like to explore that with you and make no mistake that chronic drug use can definitely take a toll on one's body. However, one doesn't have to be dependent to suffer the negative health effects of substances. And as we'll see today, there are cases where poisonings are increasing even though addiction on a particular drug is not on the rise. So we think what's happening is more people who are naive to substances are using them. The drugs are often more pure and lower cost now, and they quickly find themselves on the wrong end of a drug overdose. So we're going to examine some of the acute toxic effects of commonly used drugs, focusing on overdose deaths. And again, we'll discuss the fact that trends in drug use don't always capture the full story. And later on in the session, I think this will become relevant as you're going to hear about prevention efforts to try to stave off this increase in overdose deaths. So if we just take a snapshot view of drug use in the United States, we find that about 1 in 10 people 12 and older in the US uses an illicit drug each month, which is actually a pretty large number if you think about it. It's about 27 million people. Most commonly, it's marijuana. Almost 1 in 10 adults, well, actually 1 in 10 people 12 and older uses marijuana in the United States now, at least monthly, followed by pain medications. You'll see on this slide, it says pain relievers. Really what this is prescription narcotic pain relievers. Tranquilizers like the benzodiazepines, such as Valium, and the benzodiazepine-like drugs like Xanax. And in that category, I would also include sleep medications that are like benzodiazepines, like Zolpidem or Ambien, it's called on the brand name. And then cocaine, et cetera, et cetera. And if we look at trends, as I mentioned, we don't really see much of a change in drug use in the US over the last decade. However, simply because of the sheer number of people involved, small changes can become significant, and there is a small significant uptick in drug use in the US overall. About 10 years ago, around 8% of the population, 12 and older, used substances once a month. Now it's about 10%. Not very big, but it is an increase of a small amount. And interestingly, it's not among adolescents, and it's not among young adults of college age. It's among people 26 and older. And this is important because, as I'm going to show you in the next slide, there's been a significant increase in deaths due to poisoning, and it's mostly among people older than adolescents and young adults. It's among people in the adult age range. And so a paper came out just a few months ago and reported that if you look at overall mortality in the United States and various countries, what you find is that in the age range of 45 to 54, which I'm on the leading end of, mortality is going down across the globe, except for in the United States. It's actually increasing. And if we look at why that's happening, there are 3 categories of death that are increasing in my age range. And all 3 of those things are related to drug use in one way or the other. Chronic liver diseases, of which about 50% are alcohol cirrhosis. Suicides, of which at least 1 in 5 are alcohol-related, and certainly other drug-related. And then poisonings, which is the steepest increase. And poisonings are happening with a variety of categories of drugs against the backdrop of no real changes in drug use, except for that small uptick. So if we were just to look at the pure epidemiology of drug use in the US, you might say, oh, the problem isn't getting any smaller, but it's also not getting much bigger. In reality, we've got this big increase in death. So if we look at just the overall rate of death due to, this is number of deaths due to prescription drugs as a category, There's an increase for both males and females, and it's quite large. And of course, what I'm about to show you is what I think you already know. Most of these deaths are due to narcotics, but not just narcotics. And whenever there's more than one drug involved, the odds of a poisoning death go up. So even though I'm going to break this down by category, remember that within a category, most people are using other drugs too. And whenever you're using multiple drugs, the odds of death increase. So here's specifically prescription opioid pain medications. And you see this very large increase for males and females. About 16,000 people in the United States die every year now just from prescription narcotic pain medication overdose deaths. And you'll see a trend here that's going to appear in every slide I show you of overdose deaths. It's more males than females. However, just because it's more males doesn't mean the problem isn't a very important women's health issue, because with several of these drugs, the rate of increase is greater for women than for men. Now, interestingly, I just showed you that death from prescription narcotic pain medication overdoses has steeply increased. But if we look at use of prescription narcotic pain medication, it's actually not going up in any age group, and it's coming down quite a bit in the young adult age group. So again, despite the decline in use, the number of people who are dying is going up. And so in my institute, the National Institute on Alcohol Abuse and Alcoholism, we refer to this as an increase in intensity of drug use. I'll show you some slides in a few minutes that show that alcohol use is not going up, but yet hospitalizations for alcohol overdoses have gone up steeply, particularly among young people. And so what's happening is there are fewer people crossing the line of use, but those who are going to greater extremes. There are more people going to extremes. And also with drugs on the street, there are certain drugs that we know are not pure drugs. We've got a real problem with fentanyl being mixed with heroin, which can be very toxic and more easily lead to an overdose. So moving on. The Centers for Disease Control is very serious about trying to deal with this problem of prescription medication, narcotic medication overdose deaths. And what they're pointing out is that a very small number of doctors in the US account for most of the prescriptions. And so this is really an issue where the number of prescriptions to people has increased over the years. And what this slide shows you is that as sales of narcotic pain medications has gone up, so have the deaths. And in the last couple of years, as sales of prescription pain medications have gone down, so have the deaths. And so this is a problem that's interesting in that it's not coming from a foreign country. It's not coming from clandestine labs. It's coming from pharmaceutical companies through a relatively small number of doctors. Now, what's fascinating about this is at the same time that we've had this prescription narcotic increase in prescribing and in deaths, the amount of heroin available on the streets in the US has increased, and the purity has increased, and the price has gone down. So in the US, if you live in the US and you want to be a heroin addict, now's the time. So what's happened is, as the number of prescriptions has started to come down, the number of heroin users has gone up greatly. And the number of heroin overdose deaths has gone up greatly. So we've created quite a few people addicted to prescription narcotic pain medications who now are having a harder time than they had before getting the meds, and so they're going to heroin because it's actually cheaper. And they're overdosing and dying. As I mentioned, there are some instances where even though males the number of males who are dying from poisonings is higher than for females, it is an important public health, women's health issue because the rate is actually increasing faster for females. And we're seeing that with several different drugs, including alcohol. There's basically narrowing of what we call the gender gaps in drug use in the United States. The traditionally large gaps between male drug use and drinking and female drug use and drinking is narrowing over time due to usually steeper increases for females than for males. And so, for instance, in the United States, there are 48,000 women have died from prescription narcotic overdoses during a 11-year period from 1999 to 2010. A bigger increase than for males, 400% versus 265%. It's going up for both sexes, that's for sure. But what's interesting is that this number is sort of startling to me. That's for every woman who dies of a prescription painkiller overdose, 30 go to the emergency department for painkiller misuse or abuse. So behind all of these deaths, there's a massive number of emergency department and hospital visits for excessive consumption of these medications. So every 3 minutes, a woman goes to the ER for a prescription painkiller misuse or abuse. And I put this slide in here to basically show you the age groups where most of these events are happening. It's not in teenagers. It's not even in young adults. It's between the age range of 25 and 64. Now, moving on, if we look at other overdose deaths, benzodiazepines, which I mentioned, classic benzodiazepine would be Valium. But these are sedating, anti-anxiety meds that benzodiazepines is this very specific category, but there are lots of other drugs that are like benzodiazepines. Like Xanax is not a true benzodiazepine, but it's very similar. Zolpidem, which is Ambien for sleep, Lunesta, these things all act in a similar way at the GABA-A receptor in the brain. And there's been an increase in deaths attributed to benzodiazepines over the years. And what's interesting to me about this is it's very hard to die from an overdose on benzodiazepines. You have to take quite a bit. So this trend tells us one of two things. One is people are taking these meds in much larger numbers, larger doses, or they're mixing it with other things. And one thing that is certainly going to increase your odds of dying from a benzodiazepine overdose is alcohol. Alcohol increases the risk of death from overdose for any drug that has sedative properties. And I'm going to show you the brain mechanism for that in a moment. It's very, very simple. But mixing a benzodiazepine and alcohol can be a very deadly combination, whereas the benzodiazepine itself may not kill you. It might put you to sleep for a couple days, but it may not kill you. And so, as I mentioned, combining drugs leads to a worse outcome, and that's definitely the case with benzodiazepines. I know this slide the type is pretty small. Let me just tell you the story. Basically, there's been this big increase in benzodiazepine hospital visits, emergency department visits. The outcome is much worse if there's either alcohol mixed or narcotics mixed. And by outcome being worse, I mean these people get transferred to a hospital, these people die. They're much more serious cases. And so mixing these substances is particularly dangerous. Now, as I mentioned earlier, in the last couple of years, as we've reduced the amount of prescription narcotics on the street, people have discovered, people who are struggling with addiction to these narcotics have discovered that heroin is cheap and pure and works, does what they need it to do. Unfortunately, that's leading to a big spike in overdose deaths due to heroin in the US. And what's fascinating to me about that is, again, another busy slide, but this shows us that it's really across sexes and all age groups and all financial categories. And so it's really a nationwide issue, as is narcotic pain medication addiction. And so it makes sense. But the graph on the right shows, is it your right? Yes, your right. No, your left shows you that there's two lines there. One is for heroin-related deaths, and the other is for heroin addiction. And as you can see, the rate of death has outpaced the rate of addiction. So these aren't even all addicts. These aren't all people who are moving from, who are addicted to heroin or start addicted to narcotic pain medications, they move to heroin. There's just a general increase in death due to heroin. It's really spiked in just the last couple of years. And it's fascinating to me how it follows so closely with the changes in prescribing practices over just the last few years for narcotics. I mentioned alcohol. Alcohol is interesting. Well, I'm an alcohol researcher, so of course it's interesting to me. But one of the things I find fascinating about this is if we look at the young adult age group, in the United States, we spend a lot of time talking about alcohol use among young adults. College students fit in that age group. We give a lot of attention to excessive drinking at college. We're just, I think, starting to really focus more on people that aren't in college. In the United States, only about a third of people in this age range go to college. The rest go into the workforce, join the military, do other things. And alcohol use among the non-college population actually has gone up while it's coming down in college. But the changes in alcohol use have been small. In contrast, the rates of hospitalization for alcohol overdoses has been big. In this 10-year period, the data end in 2008, there was a 70%, nearly 70% increase in hospitalizations. So these are serious alcohol overdoses that require hospitalization, and there's been a big increase, despite the fact that overall levels of drinking haven't changed much, and this slide shows that. For all age ranges in the US, there isn't an age range that's shown an increase overall in drinking, and in fact, in the 18 to 25-year-old range, it's stayed pretty flat. But we've had this increase in hospitalization. So even though there aren't more people drinking, those who are, there are more of them going to extremes and ending up in serious trouble. And as I mentioned, when you combine drugs, there's a greater risk of overdose, and that's certainly the case with alcohol and narcotic pain medications. What this shows is, again, the same age group, 18 to 24, there's been a 120%, 122% increase in hospitalizations for both males and females for overdoses on opioids, mostly narcotic pain medications. And across that time, consistently, about 20% of those cases also involved excessive drinking. Alcohol really works to potentiate the effects of several different categories of drugs, particularly the narcotics and benzodiazepines, on brainstem areas that keep us alive. If we look at deaths due to narcotic pain medication, this is a busy slide, but it's basically 15% over the years are noted to have excessive alcohol consumption. And that's a big deal, because alcohol usually or often isn't noted in a death certificate unless it's very clear that the alcohol contributed. If there's another drug involved, it's usually attributed to that other drug, and alcohol is left out. So why does this happen? Well, let's take a look at the benzodiazepines and narcotic pain medications, heroin and alcohol, all suppress what we call vital reflex centers in the brainstem, the very base, lower part of the brain near the base of your skull. There are a few small areas with some neurons that control your vital reflexes. For instance, keeping you breathing, keeping your heart going. If you gag, something blocks the airway, you gag and you try to clear the airway. These things basically are required to function if you want to live. And all of those drugs will shut those things off. So you can directly stop breathing, your heart can stop. With alcohol, it's often the case that somebody drinks enough that they vomit, inhale their vomit. The brain doesn't respond to that blockage of the airway, and they drown. Somebody drowns in their own vomit. But that's why these drugs are also dangerous to mix, because they all act on these same life-sustaining reflex centers in the base of the brain. Other drugs don't. Cocaine, for instance, will kill you for other reasons, but it doesn't block these centers in the base of the brain. Cocaine use has gone down in the US, as have cocaine-related deaths, but I want to point out that cocaine is toxic for different reasons. It will kill you often by making your heart stop functioning. It will put you into cardiac arrest, and you can die from that. Same thing with amphetamines. What about marijuana? I think most of us are aware that it's unlikely you're going to die from an overdose on marijuana. My mentor, when I was at Duke, used to say that there were potent strains of marijuana that he called hospital pot. And it wasn't because you had to go to the hospital, it's because you thought you needed to go to the hospital because you thought you were going to die. And often when people end up in the hospital for marijuana overdose, it's because of anxiety that they're going to die, even though nothing life-threatening is happening. Marijuana has become legal in, I think, almost half of the states in the United States have either medical or they decriminalized, or Washington, D.C., the capital, has legalized marijuana. So over time, we'll learn more. Eventually, there will be deaths attributed to marijuana. But for now, I can tell you that the number of hospital visits and emergency department visits related to overconsumption of marijuana, particularly edibles, where somebody doesn't know what they're doing, they eat a bunch of food with marijuana in it, and then they feel overdosed. They're really concerned for their lives. Those are going up. So I'm going to show you some data from Colorado As Colorado has legalized marijuana, which it did a couple years ago, there's been a pretty immediate increase in hospital visits and emergency department visits. I was talking to an emergency room doctor at a conference last week, and he told me this story about it's very sad, and I'll just share it with you. A couple, older couple, elderly couple, the husband went into his son's room and found some candy bars, and he ate them. And they were edibles. They had quite a bit of THC in them. And he became unresponsive. He was unconscious. They couldn't get him to wake up. So she took him to the hospital. The doctor there figured out what was happening. And while he was in the hospital, still unconscious, she had an aneurysm and died. And so by the time he woke up in the hospital, his wife had died from the stress of having to take him to the hospital for overdosing on marijuana. So, you know, these things do happen. Emergency department visits, as I mentioned, have gone up just over the last couple of years in Colorado as a result of legalization. So I think, you know, in a couple of years, if I were to come back, I'll have a different story to tell you about the epidemiology of excessive marijuana consumption. But as of right now, we don't have any trend data on deaths that we can attribute to it. Okay, so to summarize, you know, clearly addiction places a significant burden on the body and produces myriad health complications. But an individual doesn't need to be addicted to suffer toxic effects from drugs, particularly drugs that affect the brainstem vital reflex centers like narcotic pain medications, heroin, alcohol, and benzodiazepines, particularly if the benzodiazepines are mixed with one of those other categories. It appears that overall trends in substance use and trends in deaths due to the acute toxic effects of substances can follow different paths. In other words, if you were to just look at the basic trend data in the US, you would say, wow, you know, you're making some progress there, or you're keeping the problem from getting worse. But when we actually look at the death data, we find that there are quite a few more people dying from drug overdoses in the US over the last decade, particularly benzodiazepines, narcotic pain medications, and heroin. And hospitalizations for excessive alcohol consumption have gone up as well. And I believe in the next talk we're going to hear about how we can use overdoses as an opportunity, as a window of opportunity to use science-based prevention approaches to try to prevent a repeat overdose. And that's all I have to tell you. So thank you.